From the station that's on your side, this is Channel 7 News Daybreak.
6:24 is our time. Welcome back into Channel 7 Daybreak. November is right around the corner, and November is National Diabetes Month. It's a time when communities across the country team up to bring attention and awareness to diabetes. And this year's focus is on prediabetes and preventing diabetes. Joining us this morning to keep us healthy is Dr. Erica Stokes with Baptist Health Family Center in Otter Creek. Dr. Stokes, first of all, good morning and thanks for joining us here in studio. Let's go ahead and get right to some of these questions this morning. We're going to focus on preventing diabetes. I know that's something that you probably talk with your patients about all the time. So what does it mean when we say prediabetes?
So prediabetes is when patients have a higher than normal blood sugar, but less than diabetes itself, and it's a serious medical condition.
Okay, how many adults are we talking about here that have prediabetes or are considered pre-diabetic?
So more than 1 out of 3 Americans has prediabetes, and many people don't know that they have it.
All right, so prevention now, let's get to that. When it comes to prevention, what are things people can start doing at home right now today?
So making healthier lifestyle decisions, exercising, staying active, trying to get 30 minutes of exercise in at least 5 days a week, and working on some weight loss.
Weight loss, certainly a big part of that. How does weight loss play a part in prevention and also even the treatment of diabetes and prediabetes?
So if patients are able to lose even around 5 to 7% of their starting weight when they find out, they may be able to prevent progression onto diabetes. So we really try to focus on that.
All right, what types of foods should people eat or start eating to make some of these small but important changes?
So foods that are low in fat, low in sugar or carbohydrates, healthier drinks, water over sweet drinks and sodas, and even limiting fruit juice in folks with prediabetes.
All right, let's talk about vaccinations here for just a moment. We have heard there's been some research and some data indicating that diabetes, and especially with COVID-19, there have been further complications of those who have had diabetes and gotten ill with the virus. What can you tell us about staying up to date on vaccinations and how to help people who maybe are pre-diabetic if they are to contract something like COVID-19?
So it's important to remember that pre-diabetes and even being overweight are comorbidities. And so getting your flu shot, your COVID vaccine series, and even your booster, if it's available to you, is really important to help prevent you from developing serious complications should you come down with those conditions.
All right, Dr. Erica Stokes, thank you so much for joining us this morning from Baptist Health Family Clinic in Otter Creek. And if you would like to contact Dr. Stokes or any of the great folks at Baptist Health, you could do so anytime at the information on your screen.